I'm Phill Wilson. I'm president and CEO of the Black AIDS Institute. I talk a lot about, this is what HIV and AIDS looks like on treatment, because there are a lot of people, particularly in the black community and in the gay and lesbian community, and particularly among young black gay men, whose images of HIV are old tapes. This is Stephanie Brown. Stephanie spoke at USCA in 2013. I wish I had a photo of Stephanie in my pocket, because every time I talk to someone who's living with HIV, who's nervous about treatment, I would whip out Stephanie's photo and say, this is what HIV looks like on treatment. Stephanie told me a story about a young man she met at a gas station who thought that she looked good. And he approached her, and he wanted her number, and she said, sure, but you should know that I'm HIV positive. He said, whoa, I didn't know. You don't look like you have it. You don't look like you have it. Stephanie said, well, this is what living with HIV on treatment looks like today. Well, this is what HIV looked like to him. This is my friend, Pedro Zamora, from MTV's The Real World. We lost Pedro in 1994. There are still folks who think that this is what HIV looks like. They think of HIV in the same images that we saw in the mid-'80s and the early '90s. And now, because of the new treatments that are available, now people, in fact, who live with HIV, who have HIV, can live almost as long as a person who's HIV negative. And so we need to develop a different narrative. And that narrative has to be that by going on treatment, you can live a longer, healthier life. I've been living with HIV for 35 years. I'm alive today because I have the love and support of family and friends. I'm alive today because I have the care and treatment I need and deserve. I personify what can happen when you are on treatment. But sadly, too few of us are on treatment. We have made tremendous advances, definitely, but we are still getting infected at alarming rates. We are still getting sick at alarming rates. We're still dying at alarming rates. We need to look at the fact that 60% of black gay men are likely to be HIV positive by the time they are 40. Now, if Black Lives Matter, we need to look at the epidemic that's happening for young black gay men who are HIV positive. So when we look at the treatment cascade, what we see is that we're failing to get the job done. There's roughly 1.2 million Americans living with HIV. About 86% of them have been diagnosed. That's not too bad. About 88% of them have been linked to care. We're losing some, which is a problem, but that 80% today is much, much better than it was just 2 years ago. But then the wheels fall off. We can get people tested, we can link them to care, but we can't keep them in care. And that's a problem. Only 40% of the 1.2 million Americans living with HIV have been retained in care. Only 37% actually are on ARVs. And only 30% of folks who are living with HIV in this country have optimal care and are virally suppressed. But it doesn't have to be that way. We actually have the tools to end the AIDS epidemic. We have new surveillance tools. We know where the epidemic is, sometimes down to the census tract or zip code. We have new diagnostic tools. It has never been more important or easier to know your HIV status. We have treatments that are available that are easier, more effective, and they work. We have new prevention tools. We have the ability, with treatment as prevention, to break the back of transmission. We can reduce transmission by up to 96% if we have people who have HIV who are on treatment and their virus is suppressed. We can break the back of acquisition as well. So we have new surveillance tools, we have new diagnostic tools, we have new treatment tools, we have new prevention tools, we actually have new policies like the National HIV/AIDS Strategy, like the Affordable Care Act, that help people get into treatment. If we want to really end the AIDS epidemic, we're going to have to look at all of us. We're going to have to look at the total health. We're going to have to look at the biomedical for sure, but we're also going to have to look at culture and race and spirituality and sexual orientation, because all of those play a role in how people who are living with HIV address their treatment and how people who are HIV negative protect themselves. So when we talk about care and treatment is not just about biomedical things. Care and treatment is also about the importance of finding community and building family and understanding networks. Really, when you think about ending the AIDS epidemic, it can't just be about the biomedical. We've had treatment for syphilis for 75 years, and yet we have a raging epidemic with STIs. Every night I look at my pills. And I notice that not a single one of those ARVs that I take has a mechanism to get in my body without my help. What the pills do are biomedical. What I do is behavioral, and the environment I live in helps me do my part. We need total health because we need the biomedical, we need the behavioral, and we need the cultural aspects that a community lends to the prospect. It's a complete package, and we're not going to get there unless we pay attention to the whole package.